We're going to move to the final talk of the session to be given by Carl Schake, and that talk is entitled Data Supporting the Sustained Efficacy of Faricimab, a bispecific antibody neutralizing both angiopoietin-2 and VEGF-A.
Great. Thank you, Suzanne. Thank you, Voss, members and guests of the Academy. It is my pleasure today to present new data supporting the sustained efficacy of faricimab. These are my disclosures, and it's pertinent that I'm a consultant to Roche Genentech. Faricimab is a unique... goodness. Okay. Faricimab is a unique bispecific synthetic antibody designed specifically to bind both VEGF-A and Ang-2. In addition, the Fc portion was modified to prevent binding to both inflammatory mediators as well as the FcRn receptor. To date, the molecule has been tested in multiple clinical trials, including 3 phase 2 programs in neovascular AMD and DME. Today, I'm going to report on new data as it pertains to the neovascular AMD program. Specifically, the phase 2 Stairway trial was undertaken to assess the potential durability of 6 milligrams of intravitreal faricimab in neovascular AMD patients. In this trial, the duration between injections, once patients received 4 monthly faricimab injections, was prolonged to either a 12 or 16-week interval. To ensure adequate suppression of disease activity, subjects in the 16-week interval were all evaluated at a 12-week interval before progression to the 16-week interval. The results here on the left indicated that not only did 65% of all subjects receiving faricimab show no disease activity determined by strict anatomic and visual criteria at the first 12-week interval, but importantly, as can be seen here on the left, visual acuity gains were equivalent to monthly ranibizumab injections in both the 12 and 16-week interval subjects. These clinical data suggest prolonged duration of action of faricimab. There are 3 potential drivers of the durability signal. 1 is prolonged residence of faricimab in the eye. 2 would be sustained inhibition of both Ang-2 and VEGF. And third, and the most interesting, is the possible CNV vessel stability effects from the simultaneous inhibition of Ang-2 and VEGF. From both the phase 2 AMD programs, aqueous humor and plasma samples were collected, and population PK and PD models were derived for both vitreous concentrations of drugs as well as free VEGF and Ang-2 time course in the aqueous. This plot demonstrates the modeled clearance derived from human samples of both faricimab and ranibizumab. As one can see at day 0, the concentrations of faricimab reflect the increased drug administration compared with the amount of ranibizumab. In molar equivalents, approximately 4 times more faricimab was injected. However, what is important to note is that the slope of the clearance of faricimab compared with ranibizumab is more shallow, indicating that the intravitreal clearance of faricimab is slower than ranibizumab. Modeled PK/PD data of aqueous humor and plasma samples indicated that suppression of VEGF was sustained following faricimab, shown here in blue, and that the rebound of intraocular VEGF was slower. As expected, only faricimab suppressed Ang-2 with a time course of Ang-2 rebound, as with VEGF of 4 months. And finally, when examining mice that developed reproducible spontaneous CNV lesions, as can be seen on the far left panel, treatment with a combination of anti-VEGF and anti-Ang-2 not only resulted in statistically more CNV suppression, as can be seen in the middle panel, but 3 weeks after the last treatment, there was more continued CNV suppression with either an Ang-2 or the combination treatment, suggesting an enhanced vessel stabilizing effect of an anti-Ang-2 therapy. Therefore, in summary, faricimab demonstrated a potential for extended durability in the Stairway Phase 2 clinical trial for neovascular AMD. Potential drivers of this durability include prolonged residence, sustained inhibition, and interestingly, the possibility of vessel stabilizing effects from simultaneous inhibition of Ang2 and VEGF. And however, the ultimate benefit of faricimab in neovascular AMD is being determined through 2 ongoing global phase 3 trials. Thank you.